Welcome again to Living Well. Today we have a topic called Irritable Bowel Syndrome. You may have heard it called IBS, but we're so glad that you're here today because we want to tell you what you need to know about Irritable Bowel Syndrome. You know, we're on this journey, we're on it together, and we want to live well, not only now, but as we prepare for eternity. I want to let you know that today's program is for educational purposes only. Yes, we want you to take note. Yes, we want you to ask questions. But if you have something very specific that you need to know about, we ask that you go to your primary physician or your physician and ask those questions because we do not assess, diagnose, or treat any conditions, physical or mental conditions. Today, our presenter is Josephine Johnson. You will hear from her about irritable bowel syndrome, what you need to know. And Josephine actually has presented with us before, and so she has a wealth of knowledge. And so I present to you Josephine Johnson, who will present our topic today. Welcome, Josephine.
Thank you, Dr. Sankey. Good afternoon to everyone. Hope that you are doing well and living well. This topic is very extensive. So there is no way that I could get all the information about irritable bowel syndrome. So I picked out those that I want you to know about. So while going through this presentation, if you see the acronym IBS, it's irritable bowel syndrome. It's a long thing to write, so I didn't write it all the time. Okay? So irritable bowel syndrome. Long ago, it was around long ago, but the scientists and the health people and the physicians, they didn't study it well until the middle of the 20th century. And it's just within the last 20 years that they have developed a scientific understanding concerning the treatment of irritable bowel syndrome. So the most current research on it suggests it's a biopsychosocial, meaning it entails your thinking, how you behave, your physiology, your emotions and all that. It entails all of that because it's a systemic disorder. Approximately half of all intestinal complaints are due to IBS. It's the most common GI problem. And it gives like gas, abdominal pain, and cramps. And it is said, and I smile when I read this, it is a commonly diagnosed condition and is second only to the common cold as a reason for absence from work. And it's a type of GI disorder, and it has to do with the gut-brain connection. I'm sorry, but I can't see my slides good because something is in the way, or pictures in the way of my slides. I don't know if Dr. Sankey can move those pictures for me. Our pictures is hiding the end of my sentences. There are 4 forms of irritable bowel syndrome that have been identified. 4 forms. You have IBS with constipation, and if you see those acronyms IBS-C, it means it is irritable bowel syndrome with constipation. We have hard, lumpy stools. And you have IBS with diarrhea, loose and watery stools. And then you have the mixed form of IBS. We have both hard and lumpy bowel movements, and they can happen in the same bowel movement. So if you go to the bathroom, you can have constipation and that may pass out, and then behind that watery stool, or the other way around. And then you have IBS undefined, we have various symptoms. I didn't even know that. But through my research, I found out that there are different types of IBS. So it's a disorder of the GI tract. And we also have IBD, which is irritable bowel disease, which should not be confused with IBS. So IBS is a GI disorder. IBD is an inflammatory disease, and it can destroy the bowel walls, which can cause sores and narrowing of the intestines. But you can have both IBD and IBS. Some other names for IBS, you might hear irritable bowel, irritable colon, spastic colon, or nervous stomach. Those are some other names that IBS is called. So when I look at the word syndrome, but irritable bowel syndrome, a group of symptoms which constantly occur together, and it can be characterized by a set of associated symptoms. So the diarrhea, the constipation, the gas, the bloating, all of these put together, they form a syndrome. So irritable bowel, your bowel is irritated. Imagine when you are irritated, how you behave. We throw temper tantrums, we do this and we do that, might knock down things and go on. The same thing happens in our bowels when they're irritated. So who is at risk for IBS? So you're at higher risk if you have a family history. And you're also at higher risk if people in the late teens, early 40s. So I wonder, why do they specify people in late teens, early 40s? That's a time when you have a lot of stress. Late teens, early 40s, early 40s, you might be eating as you like. You don't care about your diet and your lifestyle between those years. So twice as likely. And they say women are more likely to get IBS than men. Why? Because of our production of estrogen and progesterone. They can interfere with our bowel muscles, bowel walls, and cause the IBS. Stress, tension, anxiety, you're at high risk. If you have any food intolerance, which we'll talk about later, like gluten intolerance, lactose intolerant, and all those things. Some persons that have history of physical or sexual abuse, they're at risk for that. And if you have had a severe digestive tract infection, maybe from food poisoning or a virus, you are at high risk for IBS. It is estimated that 10 to 15% of the adult population in the United States have IBS, but only 5 to 7% receive an IBS diagnosis. It's the most common disease that gastroenterologists diagnose. But then I read, I said Canada has one of the highest prevalence rate of IBS. It's about 18% for Canada alone versus 11% globally. So we don't want to get into that realm where Canada is. So we also take heed to the things which we have learned and apply them to our lives. So I mentioned some of the signs and symptoms of IBS before. Cramping, abdominal pain, bloating or gas, diarrhea, You have constipation, or you can have both. You might have nausea, headache, fatigue, anxiety, depression. It's a chronic condition that will need to be managed long term through diet and lifestyle changes. So, IBS isn't life threatening. And I read it and said, okay, it wouldn't give you other colon conditions or increase the risk for colon cancer. Like, it won't give you like Crohn's disease or irritable or ulcerative colitis and all that, but it can be a lasting problem if you don't deal with it. You may have to live with it. And then just have these pictures. The first one shows the constipation in your bowels. See those hard, segmented stools? That's constipation. And then this young lady, I guess she has irritable bowel syndrome. So they show you that she's in pain. And the other one shows you the colon, and it shows the areas where you have constipation, diarrhea, and bloating and gas, and spasm. Spasm is the area where the colon is indented because the muscle contracts, so it gets smaller in that area. Call it spastic colon. It is said that the precise cause of IBS, precise isn't known, but there are factors that play a role. Factors that play a role in its cause. And these include muscle contraction in the intestines. The walls of the intestines are aligned with layers of muscle that contract as they move food through your digestive tract. Some of the contractions could be long and hard, and it is said that these contractions can cause like constipation and gas and all of that. But there are some contractions that are slow. It makes the food stay longer to pass through, and it can result in diarrhea. So there's a lot to learn about this irritable bowel and muscle contractions. The nervous system, the abnormalities in the nerves in your digestive system may cause you to experience greater than normal discomfort when your abdomen stretches from gas or stool. We have nerves all over our bodies. Nerves in our abdomen, in our hands, in our legs. And when these nerves are poorly coordinated between the brain, which is part of the central nervous system, and the intestines, which has its own enteric nervous system, it can cause your body to overreact to changes that would normally occur in the digestive process. And it can result in pain, diarrhea, or constipation. So, some time ago, I'm sure we mentioned about the gut-brain connection or the gut-brain axis. It is said that the brain has a direct effect on the stomach and intestines. For example, the very thought of eating can release the stomach's juices before food gets there. And I'm sure that we've experienced that at some point or other. Or another thing I thought about, if you're going for an interview for a job, you get nervous, you want to go to the bathroom, your mind is going 100 miles an hour. thinking about what questions you're going to ask and all of that. And you're nervous. You want to go to do all the numbers. Number 1, number 2. If there was a 3, probably you'll do that too. But that's because the brain and the gut are intimately connected. Severe infection can cause IBS. It can develop after a severe bout of diarrhea with form like gastroenteritis, food poisoning, or something like that, or bacteria or virus. And IBS might also be associated with a surplus of bacteria in the intestines when there's an overgrowth of bacteria. Bacteria can migrate from one part of the intestine, the small to the large, large to small, and it can cause infection. People exposed to stressful events, especially in childhood, tend to have more symptoms of IBS. I wondered why, but I know that there's this person who was abused at a young age, and that abuse is uppermost in the mind. And so it makes the body can't do its normal work. The body then focuses on that stressful event and it leaves other things undone because it's urgent. The body sees this stressful event as urgent, so it cannot focus on digestion. And irritable bowel can come up because of the body's inability to focus on digestion. So early life stresses, especially in childhood, they tend to have more symptoms of IBS. If the microbes in your gut changes, it can result in IBS. So what causes the change? It is believed that age, diet, you stop being as active as you used to be because microbe thrive on oxygen, microbe thrive on fiber, and all of these things can affect you later in life because as we go older, we stop doing certain things. Research indicates that the microbes in people with IBS differ from those in healthy people. Other changes, other things that can cause microbe. They're saying that the way you were born, those with vaginal birth are pretty okay with their microbes because as they pass through the birth canal, they inherited a lot of the mother's bacteria, the fecal bacteria, and all of those things are beneficial for you. Antibiotics can change your gut microbe. And we know that for sure because we've said that many times on this program. Low fiber diet, less exercise, stress, prescription drugs like the NSAIDs, and I saw that morphine can cause constipation. And they said at age 60, the microbes in your intestine look very different than at a younger age. So I'm 60, a lot of us are over 60, so we have to be careful with what we eat, how we behave, our physical activity level to make sure that we keep those microbes happy. If they're not happy, we won't be happy. Diet, as I just said, high fat, low fiber, as the diet, the Western diet that we have around. But the Mediterranean diet, which is high in fiber, low in fat, is good. And then After age 70, also our immune system weakens, our psychological stress and anxiety, the medication, tobacco, and alcohol, these things irritate the digestive tract, and our lack of physical activity can cause IBS. Caffeine also can cause IBS. If you're allergic to dairy or gluten or environmental sensitivities, we can get IBS. And then I read about endometriosis. They said it coexists with IBS because they have similar symptoms. So endometriosis is where the tissue in the uterus comes outside of the uterus, and it can grow on the bladder, the ovaries, the rectum, and the colon. The pelvic area gets affected with the endometriosis. What are some triggers of IBS? You have food, which I've said a couple times. Food allergy, intolerances. So it's not fully understood. But people have worse IBS symptoms when they eat or drink certain foods or beverages, including wheat that has the gluten, dairy that have the lactose, citrus fruits, which has its own set of things. Beans can cause a lot of gas, and cabbage, the milk, refined carbs, coffee, alcohol, tea. And then I came across this FODMAP. I'm pretty sure one or two of us might have heard it. And they are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. They're just starches and sugars in food. When we eat too much of them, it can trigger IBS. Stress, most people with IBS experience worse or more frequent signs and symptoms during periods of increased stress. So the signs and symptoms of IBS, they vary, but are usually present for a long time. And you have the most common ones. You have pain in your abdomen, your belly cramps, it bloats, and is related to like passing a bowel movement. And you may see changes in the appearance of your bowel movement, changes in how often you are having a bowel movement. So, when should you see a doctor? If you have a persistent change in bowel habits or other signs of or symptoms of IBS, they may indicate a more serious condition, such as colon cancer, if you don't take care of it. Remember, they say it doesn't put you at risk, but you have to take care of your IBS because it can put you at risk for these colon cancer. So if there's a persistent change in bowel habits or the signs like bleeding and all that, you need to see a doctor. If you have weight loss, more serious symptoms, weight loss, because diarrhea and all that cause you to lose a lot of water. You're not absorbing your food, your nutrients to help you to keep healthy and keep your weight. If you have diarrhea at night, rectal bleeding, and then you end up with iron deficiency anemia because you're losing blood in your stool, you're vomiting, if you have difficulty swallowing, all of these are signs that you should go to the doctor. But I pray that we won't wait until such time to go to the doctor. So, how can we treat IBS? Lifestyle treatments, colon massage. Your colon, you have ascending, transverse, and descending. So you can just take the tips of your fingers and rub your colon just the way it is situated in your abdomen. So you rub up the right side, go across your umbilical cord, your navel, and down on the left side. And you can do that. You can get some castor oil and rub it. I told one lady that, and she thanked me very much because she has IBS, and she said it helped her a lot. So follow the line of the colon. Stress management, you can have some stress management reduction techniques. Some people might have to see a psychologist for that. Eat small meals, and this is something we say all the time: chew your food well. Don't hurry up and eat. You're going to irritate your colon. Give your body less work to do in the process of digestion. So eat small meals and chew well. We also have some supplements that we can use to help us with irritable bowel syndrome. Probiotics, onion, garlic, all those things. And then there's something called L-glutamine, which is a protein which helps to strengthen your colon wall. Aloe vera juice is very soothing. You can take some of that, about 2 to 4 ounces, and drink it. And you can also have enteric coated peppermint oil, which is going to coat your colon. Freshly ground flax seeds, you have your ginger, magnesium, and psyllium husk, which is a fiber to help as a supplement to help the relief of the irritable bowel syndrome. Then avoid eating raw fruits and veggies for a short time, because the raw fruits and veggies, the fiber in them are not broken down because they're not cooked. So that will irritate your bowel if you eat raw fruits and veggies. So you leave them out for a while, cook your veggies, eat soft fruits to avoid any irritation. Avoid sugar and refined carbs. That is a no-brainer. We have been talking about this for quite a while. The caffeine and the dairy. If you know that you have issues when you drink dairy or you eat foods that have dairy, you avoid all of these things. They are irritants. And then you have to consider an elimination diet. You can keep a food log. When I eat this today and see how you feel. And you can, if it bothers you, you don't eat it again. Some people say do it 3 times. So you start to eliminate the foods that cause the IBS to trigger. And then you slowly introduce more fiber. You don't do it one time. Slowly introduce the fiber. Bone broth, collagen, or gelatin. These are protein that can help rebuild your muscles. And they have oat bran or carob. All these are food treatments for IBS. And then you have the testing for IBS. IgG is what they test for when you have food sensitivity. They have IgG, IgA, IgC, IgD, IgM, about 5 of them, but this one is the one that they use for testing for food sensitivities. We also have a stool analysis. They go and they look for microbes in the blood, parasites, candida, and all of that in your stool. And they do organ acid tests for yeast, metabolic and overgrowth concerns. So they test for these microbes, fungi, viruses, and you can do a hydrogen breath where you blow into something and they test it and see what's going on in there. I know my daughter had to do that for testing for IBS, and the same thing for lactose. You either do the lactose breath test or you just remove the food that is causing your discomfort. Okay, and this is the last slide. So if you're experiencing any discomforts in your abdomen, any diarrhea, constipation, bloating, gas, any spastic colon, and you don't even wait till you've tried everything. Whenever you see the first sign of anything, we ought to put God in the picture. Not only before IBS, but every day as we go through the day, we have to ask for God's guidance in the way we eat, what we drink, what we wear, where we go, how we speak, and all of that. So, but God is able to heal whatever is going on according to his will. So let us pray every day. Ask God for discernment to know what makes the IBS worse. Don't eat the food and say it's going to go away, it's going to stop. If you know that milk bothers you, gluten bothers you, if you know that whatever the food is, citrus fruits bothers you, you have to get to know and don't use them until you think that you have healed enough to reintroduce them slowly. So ask God to give you the discernment to know what makes it worse so you can get some control over it. And you have to pray for comfort and peace because there are persons with IBS who are on the verge of losing their minds because it's very, it destroys your livelihood. Make it can't function, can't go to work, can't be around people, and which have to run to the bathroom or something, you're in pain. So ask God for comfort and peace to overcome this condition in the name of Jesus. And that's my presentation for today.
Josephine, you covered a lot of information. Are there any questions? If so, you can put them in the chat box or you can either open your mics. We'd love to hear your questions. One thing I found really interesting is they really don't know the cause of it, but by the symptoms, we can treat the symptoms by things that we can do. So I think sometimes we just treat the symptoms until we can pinpoint the cause. Are there any questions?
I was just going to input or find out too if probiotics, since it's a microbe problem, will what you call it, probiotics and even prebiotics help that situation.
That's the question I just said. Asking a question or you just make a
No,
comment?
if you want to elaborate more on that, yeah.
Oh, yeah, anything you can do in that area. They have pre, pro, and post biotics that you can use. So that's probably some homework. We can go online and find out what are these pre, pro, and post biotics that can help our gut to function properly.
And when should we take prebiotics? When should we take? Is it before meal, after meal, before? If you're on antibiotics, should they be taken before antibiotics or hours later?
But the prebiotics, they would have the instructions on the bottle, or your doctor, if they prescribe it for you, they will tell you how to take it. But antibiotic is one big factor that cause a lot of IBS.
Mhm.
Yeah, because it washes away the natural flora of the gut.
Destroys, destroys your gut microbe.
Mhm. Wow.
Yeah,
So I guess it's advisable whenever you take an antibiotic, so always do some probiotics.
I don't know if taking it with it is going to help, because if it's antibiotics and it's destroying your gut flora, when you take whether the yogurt or whatever you eat, it's going to kill what you're eating. So probably you take the antibiotics, and after that you start to build your gut microbiome again.
Okay. Yeah, that's good to know.
Mhm.
Thank you.
Any other questions? Well, one thing that stood out to me is stress. Stress, and we know stress is harmful to our body, but to know, I think you mentioned it several times throughout the presentation, that stress can trigger it, and even make it even worse. If so I think that would be, if you're having symptoms with diarrhea and constipation and kind of fluctuating like that, starting with identifying, are there stressors, unresolved stress in my life right now?
Right. And you know what I find too? Sometimes it might not have those significant symptoms like the diarrhea and the constipation, but it could be very subtle too. It could be very subtle, and you're not realizing that you have IBS. So that's another thing, anytime we see changes in our bowel pattern, look out, stop and think, what is really happening? What am I doing that's maybe causing my bowel movement to change?
Mhm.
I know one thing that stuck when Josephine was talking, and she was talking about the mind.
Mhm.
If you have a stressful event, well, something happened to you in the past that is bothering you, that alone can cause this IBS. So it's so important to have a mind that is free of stress or problems or worries. That's why we have to cast all our cares
Yeah.
upon the one who can really help us. Wow.
As I said, that stress is so much in your body that the body is not free to focus on normal activities. It puts all its attention on that stress, taking all the energy, all the blood flow, everything to that stress, and the rest of your body deteriorates.
Wow.
I was even thinking like stressful events. Sometimes you don't feel like you're stressed, but people around you are very anxious or very, just busybodies or whatever's going on in your environment that pulls your energy from you. I could think that would possibly trigger, of course, it could trigger you to be stressful, but I think sometimes work environments that can be very, intense and pressures and demands. and things are just happening around you, and you may realize that your body then becomes tense and beginning to have some of those symptoms that you described. So I think our environment at home, at work, when we're out in different places, we should be mindful of that as well.
Yeah, yeah. And food intolerance, that is something, another significant problem with IBS. Foods or things that we eat that we not even thinking that is causing a problem because it's so subtle. Food that's, that is, you're not allergic to it, but you're sensitive to it. The difference, you might eat it maybe right at this moment and you don't feel anything. And later on, hours later, or maybe days later, you start developing symptoms and you maybe not correlating the two. So we have, our bodies, we are fearfully and wonderfully made. So our bodies are talking to us. We need to listen, stop, listen. Why is this happening? I was feeling fine. Now something is going on. What did I do different? Or every time I eat this particular food, or even a fruit, it could be something that's healthy, is causing a problem. So you have to stop and think and go back and see what is causing the problem. Pay close attention to your body. Very, very.
I agree with you wholeheartedly. The other thing that Josephine mentioned, and we've talked about it before, but chewing your food, because when you chew it well, it becomes liquefied. The body can absorb it better. Particularly if they're nuts and grains and things that really are hard to digest anyway, really taking time to chew them well to make sure that the body can absorb the nutrients from them. Otherwise, they're going to get caught up in that colon and causes a little bit of havoc. So I think sometimes when we eat in a hurry or eat nuts and things in a hurry, the body's going to only respond because it can't digest it like it would like to.
Mm-hmm. Definitely.
So chew.
Yeah, that's why we have to carve out a time of the day where we can sit peacefully, calmly, and eat our food.
Yes.
So very important, because you might think, you're eating and eating healthy, but how are you doing it is the problem. Your food will not be digested properly. And if food is not digested properly, you don't get all the nutrients from it that you should be getting, and there you start forming problems.
Go ahead.
Yeah, so I know sometimes, I try to do that, but there are times when I'm in a hurry and I just rush, and I can tell a difference because I feel bloated. I feel still full. It's like my food is not digested properly, and which it is, it's not digested properly.
Listening to a talk the other day about chewing your food, and this health professional said, those persons.
We're not hearing you, Josephine.
I think it's off.
I can hear you now.
No,
Okay.
I guess you
I was leaning away, yeah.
Yeah.
This health professional said chewing your food can help those of us, men, women with high stomach, we call them beer belly or something like that. And if you chew your food properly, that can go away.
Yes.
So there's one lady who testified that she tried it on her husband.
Yes.
And the belly went down.
Wow.
I heard that. There was a presenter who talked about that. Her father had a stomach. And after talking to him about, chewing his food, and he started chewing, he realized his belly was gone. So here we have it. If we have a distended abdomen, maybe it's because we're not chewing our food well, because that food just sits there and putrefies. And then when things putrefy, it forms gas and bloating and all of that.
Yes. Well, thank you so much, Josephine. Do you have any final words for us before we close out?
I said it all, but we have to pay more attention to our daily habits. Eating, going to the bathroom, whether to pee or to do number two. We have to pay attention to how we feel. One class I did, they gave you a log, a 5-day log, where you write down what you eat today. Breakfast, what did you eat? How did you feel afterwards? When you went to the bathroom, what did your poop look like? And that's a 5-day log, meaning you are to look, pay attention to what's going on in you. Whatever feeling you have after you eat something, stop and think. And if you eat it again, it happens, that's an indication that you should not be eating that, or you're eating too much. When I talk about the FODMAP diet, nothing is wrong with the foods, but when you overdo the foods, it can irritate your bowels. So pay attention to you. Intentionally pay attention to you. I ate some nuts a while ago. I have to take my time and chew them. I still gonna sit in the bathroom when you go to do your number two.
Mhm. There.
So pay attention to what's going on with you. Only
Wonderful.
you can take care of you. You are responsible for your health.
Yes. Thank you so much, Josephine. Any closing words, Emmeline?
That is great. I like the idea of that 5 days diary on the foods you eat. That's a great way to start keep a check on what you eating and how you feeling. Because when you eat food, it should not make you feel bad. You should not feel tired and sleepy. You should not be having abdominal discomfort. It should not make you feel bad. Food is to nourish and to strengthen you. So
Heart
that's a good,
palpitations. Some
pardon
people
me?
get some people get heart palpitations when they finish eating. Why? Their
Uh-huh.
bodies overwork too much sugar, so they get heart palpitations. The body is working too much to get that food organized and digested, so your heart rate picks up.
Mhm.
Mm.
Wow. So let us all start a food diary, at least for 5 days. This week, let's really pay attention to what we're eating. Start this food diary and see the things that makes you feel good and the things that maybe you need to change. And sometimes, as Josephine said, we just maybe eat too much of it. And that can cause a problem. Too much of a good thing is good for nothing.
Thank you so much, Emmeline. So whatever you eat, whatever you drink, do all to the glory of God. And that's in the Bible. And so we want to make sure that you're living well each and every day. And so not only for irritable bowel syndrome that we want to avoid it, but we want to make sure that we give our body what it needs to have the nutrients, the water, the movement. I think she talked about that in the beginning. Sometimes we're not moving as much, so the bowels are being affected by that. And so we can take charge of our health because only you and only I can take care of ourselves better than anyone else. Thank you again for joining Living Well. We're going to pause the recording so that we can take prayer requests, but we pray that you will join us next week for our presentation. Emmeline, what's our presentation next week?
Mr. Clarence Brown will be with us, and he's going to be talking about striving, not thriving. Striving, not thriving. Something like that. Yes, it's going to be interesting. Yes, let us all come back and bring a friend. You know, you don't want to enjoy this by yourself all the time. Invite someone.
Absolutely. So something you've heard today, maybe you don't have irritable bowel syndrome, but you may know someone who does. Please share this information with them.